All right. Good morning, everyone. Thank you for the opportunity to present my work on behalf of my co-authors. In a province-wide cohort of 2018-2019 Western Cape public sector births, we previously observed an elevated prevalence of low birth weight in infants born to pregnant women with HIV, regardless of antiretroviral status, compared to those without HIV. Low birth weight is an important predictor of neonatal, infant, child morbidity and mortality irrespective of HIV exposure status. In the same cohort of 2018-2019 births, we evaluated neonatal mortality or hospitalization and the impact of low birth weight by HIV exposure in infants without the evidence of HIV infection. Mothers with HIV, even on antiretroviral therapy, still experience great maternal morbidity and adverse birth outcomes, including stillbirth, low birth weight, preterm birth, and small for gestation age. Neonatal infant morbidity and mortality remain persistently high even in the universal maternal era in South Africa as well as other African countries. 1 in every 4 South African children is HIV-exposed uninfected. This retrospective cohort study included all live-born infants in 2018-2019 from the Western Cape Public Data Health Center that had no evidence of HIV acquisition in the first 12 months of life. There were approximately 90,000 deliveries annually for the years 2018-2019 in the Western Cape Province. Western Cape Provincial Health Data Center uses individual data set from multiple electronic platforms as seen in the figure, using unique identifiers with routine maternal-infant linkage at birth. We extracted maternal obstetric and HIV-related characteristics. Our primary outcome is neonatal hospitalizations and mortality, and comparison groups were based on maternal HIV or ART. We compared infants HEU versus HEU using unadjusted and adjusted log binomial regression. We calculated prevalence ratios with a 95% confidence interval. After much data integration, data analysis has finally commenced of a province-wide cohort comparing neonatal hospitalizations and mortality in infants HEU and HEU. We have established a cohort of 166,288 infants. In that cohort, 81.8 were infants HEU and 18.2 were HEU infants. Comparing infants HEU by maternal ART status, 11.1 infants HEU infants were born to mothers with HIV but not on maternal ART. 56.9% and 29.9% were born to mothers on maternal ART, either started preconception or during pregnancy ART, respectively. Comparing infants by low birth weight, infants HIV-exposed were often more low birth weight than infants HEU. When comparing our primary outcome, neonatal hospitalizations, the infants HEU 13.6% compared to 15.5% had at least one neonatal hospitalizations. And mortality rate differed slightly at 7.2 and 8.5% per 1,000 infants HAU and HUU. When comparing prevalence of neonatal hospitalizations in 3 groups of neonates HEU compared to the reference group of HUU, we see that the prevalence ratios in all 3 groups of HEU are greater than 1, ranging from 11 to 23% greater prevalence of neonatal hospitalizations compared to neonates HUU. When you take into account the difference in maternal age, multiparity, hypertension, early maternal mortality, infant sex, and town, the adjusted prevalence and unadjusted estimates are very similar, ranging from 15% to 22% increased prevalence of neonatal hospitalizations or mortality compared to neonates HUU. Further adjusting for low birth weight, we see our adjusted ratios were reduced. Low birth weight accounted for 25 to 36% of the association between neonatal hospitalizations and maternal ART. This means that being born low birth weight is an important contributor to increased neonatal hospitalizations or mortality, but not the only contributor. We conducted stratified analysis that is restricting our analysis to non-low birth weight infants. The adjusted and unadjusted prevalence ratios remained associated with neonatal hospitalizations and mortality. When we do the same for low birth weight, the prevalence of the outcome was no longer higher than the reference group. In conclusion, neonatal hospitalizations and mortality were elevated in all groups of infants HEU irrespective of maternal ART. Low birth weight occurs more often in infants HEU than HUU, therefore contributing to adverse neonatal outcomes in infants HEU overall. However, amongst low birth weight infants, the prevalence of neonatal hospitalizations or mortality was not different between all groups of low birth weight infants HUU and low birth weight infants HUU. Among non-low birth weight infants, though infants HEU had 16 to 24% increased the prevalence of neonatal hospitalizations or mortality, indicating other factors beside low birth weight were driving adverse outcomes in this group. Our next step, we are undertaking mediation analysis to formally estimate the contribution of low birth weight to excess neonatal hospitalizations or mortality in infants HEU. Amongst infants HEU, we are evaluating the associations of maternal HIV-specific factors. We will conduct sensitivity analysis to determine the impact of potential misclassification of HEU infants. We will also evaluate the post-neonatal hospitalizations on mortality up to 1 year of age. I would like to acknowledge our funders for the financial support. Without them, we wouldn't have made this far. Thank you. Thank you.